This week's Ask Dr. Durie comes from a concerned patient, a patient who has been in remission for about 4 years right now, having received a stem cell transplant and been followed off treatment. Everything has been going well, and actually the patient continues to feel great. But at the time of last testing, it was noticed that the protein, having gone from 0, popped up to a level of 1.0 grams. So it had been a significant increase in the myeloma protein, but the doctor had said, oh, well, we're not going to do anything about that for now. And so the patient is obviously quite concerned and wants to understand what this recommendation means. And so the first point is that what has happened is something which is called biochemical relapse. This means that the protein level has gone up a bit. In this low level, for it to be called technically relapse, it has to go up by at least 500 milligrams or 0.5 grams. So in this case, it has gone up by more than half a gram, which means that it is a biochemical relapse. But everything else is fine. There are no CRABfeatures, and so there is not an immediate need to treat any active myeloma because there is not any active myeloma. And so this is actually a very reasonable strategy, but one which we are looking at a lot more carefully in recent years. The question now is, if a patient is relapsing from an excellent remission, how can we sustain and extend the outcome as best possible in this situation? And so we are now looking very, very closely at the value of early intervention and the possibility and the advantages of maybe treating patients who are in biochemical relapse. The idea being that there is a best outcome if you start early and have the best chance to knock the myeloma back down to its lowest possible level. And so this is a bottom line, which is please talk to your doctor carefully about these options. On the one hand, it is perfectly safe to consider the watch and wait strategy just to see what is going to happen, because sometimes the protein increases and doesn't change too much for months, even sometimes years. However, if there is an upward trend, there may definitely be a value in considering early retreatment. And with such an excellent remission for 4 years, there could be many excellent options, including a second transplant if this was desirable, or maybe one of our new very, very effective combinations, such as daratumumab Revdex or daratumumab Velcade-dex, just to give a couple of examples. And so this is a very, very important decision process right now, since we could watch and wait, or we could think about it carefully and review the possibility of an early intervention to have the very best results possible.